Assalamualaikum warahmatullahi wabarakatuh. Study designs. Descriptive. Case report, case series, descriptive epidemiology, analytical. RCT, quad study, case control study, case crossover study, cross-sectional study, before-after study, ecological study. Classification of epidemiological research, descriptive research, analytical research, observation, analytical studies, experimental analytical studies. Objectives at various levels, study types, descriptive studies, observational, analytic, experimental or interventions. Objectives: knowing the frequency of disease, knowing the distribution, developing the hypothesis, testing the hypothesis, establishing association, strengthening association, establishing the cause. Design strategy in epidemiological research, classification, descriptive studies, study designs, cross-sectional studies, population correlation, case reports. Observational analytical, cross-sectional studies, case control studies, quad studies, experimental or intervention studies, therapeutic or drug studies, preventive trials. Time frame of studies. Prospective studies look forward, looks to the futures, examine future events, follows a conditions, concerns, or disease into the futures. Retrospective. Look back into time to study events that have already occurred. Study design sequence, case report, case series, descriptive epidemiology, lab study, animal study, analytical study, clinical trials, hypothesis testing, quad study, case control study, cross-sectional studies. Descriptive studies, case control studies, quad studies, clinical trials. Increasing knowledge of disease exposure, develop hypothesis, investigate its relationship to outcome, define its meaning with exposures, test link experimentally. Descriptive study statement, assessment of disease profile among the school children, study of immunization status in children under 5 years, evaluation of blood glucose and cholesterol level in pupils, prevalence of hepatitis B and C among in high risk groups. Steps for descriptive study: defining the problem under study, defining the population under study, taking the sample of the populations, collecting the data, analyzing interpretation of data, and drawing the conclusions, generation of hypothesis. Defining the problem under study: what is the case definition of tuberculosis, what is the case definition of hepatitis B, theoretical definitions, clinical definitions, prevention diagnosis, laboratory diagnosis, what are operational definitions. Defining the population under study: geographical bound populations, age-specific populations, disease-specific populations, occupational-specific populations, hospitalized patients, vaccinated, unvaccinated, male or female populations. Thank you very much.